This is going to be a presentation on Ehlers-Danlos syndrome and hypermobility syndrome disorders and how hand therapy can help with that. This is coming from a hand therapist. I started Soma Hand Therapy back in Nashville earlier this year, and I'm a certified hand therapist with over 7 years of experience. Also, the reason that I kind of did this and why I have an interest in it is because I also have hypermobility. I think I'm 6 out of 8 on the Brighton scale, which is a scale, if you're not familiar with, that tells you if you can be considered hypermobile. It just basically goes, can you hyperextend your thumb, your knee, your elbow? Look it up. It's really interesting. So a couple things to note, liability-wise, me presenting this does not mean that it does not substitute as professional medical advice that you get from another therapist or doctor, and no therapist-patient relationship is formed through this presentation. If you do need specific information or exercises, reach out to us or your nearest physical or hand therapist to schedule a one-on-one visit. We do have virtual meetings available for those that live outside of Nashville, Tennessee. So our goals today is really just to talk about how hand therapy can help, educate on how to disrupt the pain cycle, and show you on various splinting and exercises that can help promote stabilization. Because really, it's about stabilization for these hypermobility diagnoses, right? So if you're looking through this presentation, you're likely familiar with some of the symptoms of the many symptoms that are presented in conjunction with Ehlers-Danlos syndrome or hypermobility syndrome disorders. Some of them are chronic pain issues, dislocations, subluxations, weakness, a lot of crackling and popping, a lot of issues after you give birth, such as pelvic girdle pain or problems with holding your bladder. And of course, when you're having all of that pain, you're going to have issues with anxiety and stiffness and feeling a fear of exercise and movement and activity. The other thing that tends to be really common is a lot of the people that have these diagnoses, even if they haven't been diagnosed yet, often have a concern of feeling unheard, right? A lot of those issues are waved away by the physicians or the therapists that they're working with, and they kind of use this one-size-fits-all mentality, which is not true for EDS and HSD. So the loop that we're talking about is really just at some point you're starting to feel pain, right? And so you have a fear of movement and activity because of the pain. And so as a result, you stop that activity or you reduce your activity. And as a result of that, your muscles become weaker because there is a use it or lose it situation with your body, right? If you don't use your left arm for a year, what's going to happen to it? It's going to atrophy. It's going to become really weak. It's going to become really unstable. And for people who have hypermobility issues, what that means is there is an inherent joint instability, right? The ligaments that hold bone to bone, that keeps your knee, your elbow, your fingers together are too loose. And so as a result, the secondary stabilizer, which is your muscles, has to play a bigger role in things. And if the muscles are weak because of deconditioning, because of lack of activity, because you're in pain, it's going to further increase your joint instability, which will further increase your pain. And so this is a very common loop cycle that we see with hypermobile patients that end up becoming more of a chronic pain issue, that can become an issue where they just have a total fear of exercise and activity. So we need to rethink these exercises, right? A lot of the things that people are given with EDS are that no pain, no gain, and they're told to work through it, to suck it up and just do it. And unfortunately, that's going to result in a lot of pain, especially for someone who's deconditioned. For someone who's deconditioned to suddenly do a deadlift, their form is not going to be good because they're just struggling to get through that. And then when they get that delayed onset muscle syndrome, the DOMS, it's going to hit them hard, right? And that is going to really cause an issue of wanting to go back into exercise. And they're going to associate all further exercise as bad and painful. So one of the examples that I can give you is when I was younger, I went to a physical trainer, a private trainer. It wasn't a PT, just a trainer at a gym. And I literally never worked out. This is before I went to OT school. I was an undergrad. The person gave me 2 8-pound dumbbells and had me do 3 sets of 10 squats. I had never done squats before in my life. And to go from, no squats to suddenly 16 pounds, 8 pounds in both hands for my first time, I literally had to hold the side of the railing when I walked down those stairs because my body was collapsing. Like it had nothing left in it. So obviously after that, I had severe pain. Didn't go back to that trainer. But that's unfortunately something that's relatively common for a practitioner working with someone with EDS. They just kind of go, okay, well, let's treat you like anybody else and just not focus on stretches. That's wrong. So the other thing that you really want to consider is speed and repetition. So a lot of these exercise classes that people end up going to, for example, Zumba or yoga or Pilates, those classes are fast. It's kind of a 1, 2, 3, zoom, 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 get it done. And unfortunately, the form really gets thrown to the wayside. So repetition and speed tends to take priority because, again, this is a one-size-fits-all situation. And as a result, things are going to get stretched and things may get dislocated. And that's not the best for someone who has instability in their joints. The other thing is people feel like their muscles are tight, right? So you have someone who has a really tight muscle and they think, oh, I'm super hypermobile and I'm going to stretch it. That's not the right way to go about it, right? Your muscles are tight because they're trying to stabilize your joints. It's a response and a reaction to it. So when you stretch a tight muscle, when it's the only thing holding on, you're just going to have more. It may feel good in the interim, but you're just going to have more pain at the end, and you're just really destabilizing it further. The other issue is people who have instability issues, when their ligaments are not just stretchy, but they also stay elongated. They stay stretched out. So for someone who does yoga regularly, they're just increasing that ligament movement and stretchiness and further destabilizing that joint and part of the body. So good principles for exercise, things that you really want to keep in mind is no pain is a gain. You want there to be no pain. If you feel a strain, a tiny strain, that's okay, but you don't want there to be a giant stretch, right? You want things to be low and slow. You want to focus on the form and really focus on the awareness of your body. A lot of people with hypermobility and EDS feel clumsy, and that's because your body doesn't have the same sense of where it is in space, right? There's certain nerve cells inside of our joints that tell you where your joint is in space. That's called proprioception. And when you don't have that nerve being kicked off and stimulated, your body is not really going to know where it is in space. And as a result, you're going to end up knocking your elbows and your knees against things that you thought you were clear of. So definitely reasons why you could have that bruising, and easy bruising is also another side effect of EDS. So another thing is avoiding overstretching, right? So avoid those spread eagle positions or going into end range positions. You really want to focus on gentle, stabilizing, strengthening. So isometric exercising is best. And what that really just means is you're pushing against something and no movement is happening. So for example, if you take your fist and you put it into the palm of your other hand and you push your fist into your other hand, right? Like what they do in those kung fu movies, that's an isometric strengthening movement. So if you're in a lot of pain, this is the best way to go about strengthening, followed by mid-range strengthening. You don't want to go to where your body is feeling the stretch when you're doing a strengthening, because at those end ranges, that is already a position of instability. So One of the main principles too is always starting from the center, the core. The core is your base, right? If your core is weak, everything just goes downhill. Everything from that point forward is going to be affected by that weakness. So I have a few exercises here. If you do decide to do them, remember that we take no liability or responsibility from it, but most of them are pretty easy, pretty simple, not easy, but should be pretty straightforward for you. So the first one is going to be kind of a yoga pose. I said no yoga, but there's no stretching involved with this. It's called the corpse pose, and all you're doing is you're going to lay on a soft surface. If the ground is too hard for you, you can be on the bed, and all you do is focus on the feeling of your body in that space. So keeping your eyes closed, feeling the tension in your shoulders, in your knees, in your hips, in your shoulder, in your neck, and just trying to relax everything in the whole body. So you're starting off with everything zeroed out. The next exercise is going to be a basic bridge exercise. So you're going to go from the corpse pose position, bending the knees and just very gently raising the hips up until you create a bridge with your body. You're going to push your heels into the floor, and your focus is on the tightening of your glutes and ab muscles. So when you do this, you should not be holding your breath, but you also want to focus on the tightening of those muscles and the way your body reacts to that, right? Breathing is very important. Following that, you can lower your hips down, and we're going to do supine marches. So again, with this, if it's easier to feel the contraction of your abs, you can place your hands on your stomach and just very slowly raise your legs up until it's about 45 to 90 degrees, and then very slowly down. And the focus of this is really just to work on the abs, right? Instead of doing planks, which can put a lot of pressure on your body, this is just kind of the opposite. And those abs are pulling those legs up, and you're slowly letting them drop down. So I couldn't find a good picture for this one, but essentially you can stay in the laying down position when you do this and get a strap and just go from elbow bent to your elbow stretched out in front of you, and just hold that position and hold that stretch. You can do this with a pillowcase, using the pillowcase to prevent your arms from spreading out wide or going too further inward, and holding it for 5 to 10 seconds. The last exercise is one that's really helpful. There's a lot of people who have cervical hypermobility going on, and that can cause a whole range of issues down into the hands, into the back, into the neck. And so strengthening of those muscles is really helpful. But again, you want to do this without a lot of movement. So this picture is someone doing an isometric cervical lateral flexion exercise. And all they're doing is they're taking their hand and they're putting it on the side of their head and they're pushing into it. And ideally, you would hold that for about 5 to 7 seconds. And you're not putting a lot of pressure. You're trying to keep the effort gentle, maybe 25% of your max effort, and then relax it after 7 seconds. You're going to do it on all sides, so your left, your right, behind the back of your head, and at the front of your head. And of course, if you're doing this and it feels painful, refer to a physician or another therapist. Make sure that your spine is aligned correctly. You don't want to strengthen if it's misaligned, right? That's where you may want to talk to a chiropractor, get x-rays or something like that. Because again, this is not a one-size-fits-all situation. You do not want to do things if it hurts you. And that's a core principle, unless you have chronic pain issues, in which case a little bit of discomfort it may be expected, but again, nothing intolerable. The last thing I want to briefly talk about is the fuel that you feed your body is going to give you a sign of how well it's going to function. If all you're doing is eating Cheetos and nachos and fries and chicken nuggets, your body is going to take all of that and run with it. And a lot of times there's a lot of really good research right now on the gut biome and chronic inflammation in the gut that spreads out amongst the rest of the body. And a lot of that chronic inflammation can really start to show in joint issues, joint pain, fatigue, weakness, issues with sleep. So I'm not a dietitian, so I can't necessarily give you the whole roundabout on all of this, but it is something to definitely look at if you haven't looked at the link between what you're eating and how you feel. But as a whole, research shows that eating more of things that are involved in the Mediterranean diet, tomatoes, fruits, nuts, leafy greens, and seafood, fatty fish, oysters, and clams are the best. Also, turmeric and garlic are supposed to be very helpful for people with a lot of inflammation and arthritis. And as we mentioned before, you really want to avoid processed meats, fried foods, sugars, and gluten is one of those contradictory things. A lot of people say that, most people aren't really gluten-free, but they do show that some portion of people do have a non-celiac gluten sensitivity, which can cause that fatigue, that joint pain. So if you don't want to be tested for that, then try to cut out gluten for 2 weeks out of your month and see how you feel, right? And if you feel significantly better, you may have a non-celiac gluten sensitivity, which is different than being a celiac person. So, of course, refer to the nutritionist and dietitian for any customized diet plans and see if hand therapy can help you. And they can help you by, like we said before, we can provide custom exercise programs at your pace, and we'll supervise your form and provide feedback. So a lot of times people tend to compensate because they don't know where their body is in space. And so they compensate by lifting their shoulders up or lifting their hips up when it should be down. And that supervision and that feedback is really helpful for someone that is starting off, especially. So performing manual therapy is helpful, and also being able to learn how to do it yourself. So you're not reliant on the therapist 100% on being able to make yourself feel better if you need to. Some people who have very hypermobile joints or chronic dislocations may benefit from having splints made. And of course, it's on a case-by-case basis. You'd have to talk with a hand therapist about that. Activity modification and certain modalities and treatments can help with pain. And then, of course, one of the biggest things is also getting a regular objective measure. So it is something that is slow, but it is something that is very helpful when you're starting out because you can get your grip strength, your pinch strength, your levels of pain, and continue to gather that as you progress through your therapy or your physical exercise programs. So these are the various splinting and rings that hand therapists can offer. These are through the Silver Ring Company, and these are sometimes covered by insurance. Every insurance is different, of course, American health insurance. So you'll have to double check with the provider and your insurance. But you can also get them for typically cheaper on places like Etsy or zebrasplints.com. And zebrasplints.com is a wonderful website. She actually has EDS, and she makes all of her own splints. So check her out if you are interested in any of those. And the reason we need them, right? Not all of us do, but some people have a tendency to hyperextend their joint. And over time, what ends up happening is the ligaments that support the finger start getting outstretched and elongated. And so as a result, hand deformities can occur. So when that occurs, really what we're looking for is a bending of this joint, which we can use with these, right? So same thing for the thumb. You'll see a collapse of the MP joint of the thumb here, which is going to cause a further boutonniere of the thumb. And then you can correct that by wearing splints. If it's super severe and it's uncorrectable, sometimes splints are not going to help. It really depends on the joint itself, right? If the joint is pretty much fused and 100% arthritic, you're likely going to have to talk to an orthopedic surgeon. But in most of the cases with EDS, splints should be viable. So we provided some references here. And if you have any questions, feel free to contact us. We're located in Nashville, Tennessee. You can email me at any time or call my phone number, 615-800-8017. And again, it was wonderful having you here listening, and I hope you have a wonderful day. Bye.